Intervertebral disc disease, or IVDD, is a condition in dogs where the cushioning discs between the vertebra of the spinal column either bulge or burst into the spinal cord space. These discs then press on the spinal cord, causing pain, nerve damage, and even paralysis. Breeds that are predisposed to IVDD include Dachshunds, Beagles, Basset Hounds, and even Shih Tzus. Type 1 IVDD is common in the neck region of smaller breeds. The discs develop a hardening of the outer layer, and damages to the disc can allow it to break down even easier. Any forceful impact, such as jumping or landing incorrectly, can cause one or more of the discs to burst and the material to press on the spinal cord. With type 2 herniation, the discs become hardened and fibrous over a long period of time and eventually break down, bulge out, and can compress the spinal cord. When the nerves of the spinal cord are compressed, the nerve impulses aren't able to transmit their signals to the final destination in the limbs or even the bladder. Depending on the location of the disc that's bulging, signs may occur anywhere in the body, ranging from the neck all the way back to the rear legs. Symptoms of IVDD in dogs may include unwillingness to jump, pain and weakness in the rear legs, crying out in pain, anxious behavior, muscle spasms of the back or neck, a hunched back or neck with tense muscles, reduced appetite and activity level, and loss of bladder or bowel control. Examination by your veterinarian will include a complete neurologic exam, which will help identify where in the spinal cord the injury is located. X-rays may show an abnormal area in the spine, but since the spinal cord itself doesn't actually appear on X-rays, special imaging may be necessary to locate the actual source of the injury. One such procedure is called a myelogram. Your veterinarian will inject a special dye into the spinal column, which surrounds the spinal cord and allows it to appear on the X-rays. This test requires your pet to be put under anesthesia, and in some cases, further testing, such as a CT scan or an MRI, may also be used to locate where the nerves are being pinched and if it's necessary for surgical repair. Depending on the severity of the damage to the spinal cord, treatment can range from conservative to surgical. Conservative care usually includes treatment with drugs, such as steroids or anti-inflammatories, to reduce the swelling of the cord and reduce pain. The dog must also be kept confined in a crate or a cage for up to 6 weeks to prevent further damage from occurring. If the damage is too severe and the dog is paralyzed or incontinent, conservative therapy may not be enough. In these cases, emergency surgery is needed to open up the space around the spinal cord. Prognosis will depend on the severity of the spinal cord damage and the treatment that's required. In breeds that are predisposed to IVDD, keeping them at a lower weight will help reduce the stress on their backs and necks. Walking with a harness will also help keep stress off the neck, and pet parents should discourage these breeds from jumping off of high surfaces.